Welcome to the Healthiest Tech Talks, where we're talking about some of the biggest challenges facing healthcare organizations today and how technology can transform the way we work so that patients receive better care. I'm your host, Natalie Tollefson, Senior Director of Customer Success at Optimum Healthcare IT. Let's dive in. Hello, everybody. Thank you for joining today. I am so excited about this series because, man, there is so much that can be solved for, so much that can be improved. And if you're like me and you spent your entire career or a large portion of it in healthcare, then you know that it is complex. Everything from patient care moving outside the four walls to the regulatory components to the back office complexity of process and administrative needs across the enterprise. There's a lot to unpack here. So I am so excited and honored that you guys have decided to start to unpack some of that with us. I have here today our esteemed guest, a good friend and colleague of mine, Brian Maguire. Brian is an enterprise architect here at Optimum Healthcare IT. He has an extensive background in healthcare and also delivering a great value from the ServiceNow platform for health systems. So, Brian, before we jump into the topic today, which is tackling some really key administrative and operational challenges that many of our listeners and attendees here are probably experiencing, why don't you give us a bit of your background and, why is this topic important to you?
Sure. And Natalie, thank you for having me. Scott, thanks for the excellent intro. And all our friends here that are tuning in, I really appreciate you guys joining. Should be a really fun conversation. So as Natalie mentioned, I'm Brian Maguire. I'm an enterprise architect at Optimum. My background has always been healthcare. I've worked in pre-hospital EMS for a period of time. So about the last 15, 20 years, I've been doing healthcare related activities. Shortly after EMS, I transitioned to the hospital setting. I worked in emergency management, doing emergency planning, transitioned into business and organizational continuity, risk management. And then I started working in IT service management, which really became a passion of mine because I just enjoyed all those different moving parts. And then developed and led a platform team as a platform owner of ServiceNow at that hospital. So when we built that out, we really went beyond IT. And we got to spread our passions with our other colleagues in the hospital providing services to the team. So I absolutely love this topic. I absolutely love solving problems. I absolutely love talking about how we can be better in healthcare with technologies, especially with ServiceNow.
That's awesome, Brian. And for those who don't know me personally, I have a background in HR, in healthcare as well, and supporting providers and helping medical directors, provide professional development, performance management, and, really drive job satisfaction within healthcare. So, Brian, I feel like with your background and my background, I mean, we've had such a blast just digging into this topic. There's so much to unpack here, like I mentioned, and I'm excited to jump in. So let's do it.
Let's do it.
All right. So one thing I wanted to kind of tee up for our audience here is um, something that was reported on a couple years ago from McKinsey. They did this really massive study, and basically they took they analyzed the profit and loss statements of um, a bunch of different healthcare organizations, like almost 18,000, and they compared it to what they saw in non-healthcare organizations. And something that they uncovered was that this bucket of administrative spending, right? Um, and furthermore, industry agnostic administrative spending. So your corporate functions, right? Your general administration, your HR, IT, marketing, finance, etc. That category alone accounted for $369 billion of spending in the healthcare industry alone, which really blew my mind because um, that's such an important area. And there's all, and we know, Brian, because we've been in this, we've been in the technology and the healthcare business, that there is so much complexity with processes just when you're talking about corporate functions,
Yeah.
right? Furthermore, I want to share this. The study actually reported that if healthcare organizations really made a priority to leverage technology to simplify their back office operations, that they could actually save 28% of that spending, which is mind-blowing. I mean, just imagine, if you kind of average all the numbers out, right? Just imagine you as a healthcare leader, um, and your organization saving, 15 to 20 million dollars a year because you have decided to go all in on leveraging technology to simplify your processes,
Yeah, it's
to
big money.
simplify your user. It's insane, right? And I think that's what gets me excited to go to work every morning because, and you and I talk about this a lot, right? We get to help people do this. We get to help people realize that value. And by the way, Brian, the study actually shared that could be done without sacrificing quality.
Right.
Um, which is cool. So what is your take on this? Especially with your experience working in a health system, managing a platform, like how do
Well,
you
it's
receive this?
it's it's no surprise. I mean, I think we've worked in healthcare. We get to joke around and beat ourselves up a little bit, knowing that we work in a very complex environment. We work in a very siloed environment. A lot of the corporate functions or the service delivery organizations, these teams they don't work well together, and for whatever reason that is, I don't know. I don't think we can blame healthcare, but I'm sure we could blame someone or something and figure it out and make sure we're doing it better. But it doesn't surprise me at all. There's just
Yeah.
so much waste that goes on, and you're going to implement systems like Lean, Six Sigma, for
Hmm.
quality outcomes, and then but you also need to balance that process with a good technology. So I know we're going to be talking about ServiceNow, but we're also going to be talking a lot about process today because
Yeah.
that's the backbone of the organization because it's those broken processes that are causing that administrative overhead.
Yeah, no, that's exactly accurate. I mean, I think there's a big enough conversation here, system agnostically, about what needs to change to realize these gains and these savings. But the reason that Optimum is specifically talking about ServiceNow is because we've recognized that, given our deep expertise across the healthcare industry, that ServiceNow really does provide that opportunity to address those issues, right?
Yep.
Across the entire organization and across the business landscape. So it's there's so much opportunity there. So for our attendees here, if you are listening in and you're already using ServiceNow, like you're on the right track, maybe you're considering it. This is not a sales pitch for ServiceNow. We're really talking from our experience in using ServiceNow with our customers and how we've seen these challenges addressed. And so I hope that you guys gain some value from this. But so Brian, um, let's kind of break this down, right, for our audience here. If you had to um pick like three main challenges um, with back office corporate functions that are operationally complex. What's the first one that you would call out?
I think you have your frustrated users with these teams, right? It's very difficult sometimes. You send a ticket into IT to get your computer fixed, or you're having an issue accessing Epic or any of your EHR or any of the other systems, and it just kind of goes into that black hole. It goes into the abyss of IT. Where did it
Yeah.
go? I called for a request. I might have sent it into the wrong place. I might have called HR because I needed access to my Workday system, but but I needed to call IT. So redundant
Mm.
steps, excessive clicks and forms that go through these different systems. And, dare I say, there's probably still paper-based forms out there that we need to do to requisition things. And this is all stuff that really builds up and adds up to that, almost $400 billion spend.
Yeah. I think you're so right. And I know this from my experience personally, just working in healthcare and being in HR, right? Like one of those administrative functions and the spreadsheets and the emails and trying to keep up with everything. And I think a lot of healthcare organizations are extremely service focused. Would you agree?
Absolutely.
We want to take care of our providers, we want to take care of our patients, and there's almost this like this martyr syndrome where we're like, well, it may cost me extra time, but I just want to make sure that we're doing the right thing for our customers, our internal customers. But the reality is that, I think a lot of end users of ServiceNow struggle, and it is frustrating. I'll tell you, Brian, there's times where I'm like at the gym or I'm at like my kid's birthday party, and you know how you small talk with other parents and whatever. And we talk about our jobs, and there was a time where I was talking to someone, I was telling them, yeah, I work in, I work with the ServiceNow platform, but I do business consulting and whatever. And they're like, "Oh, you work with ServiceNow." And I'm like, "Yeah." And they like kind of cringed.
Yeah, it's that face. I know that face.
And that broke my heart because, I'm a huge fan of ServiceNow. I'm a huge fan of good business practices and we've seen it be successful, but um I think it just comes down to the way it's implemented, the way that those processes are designed. And if it's not designed from the end user experience and it's not well adopted, you're going to get those frustrating users who feel like they're being forced to use it, but
Yeah.
it's not a good experience. It's not helping them be productive.
Yeah, and that's where the process design comes in.
Mm.
When you sit there with your users, I oftentimes, and I've done this myself as a platform owner, as an IT leader, I've done this myself. Well, you know what? We're just going to figure this out as an IT shop, and we're going to deploy it, and they're going to use our system if they want their stuff. And
Mm.
that's probably a decent norm because we all have work to do. We're very busy. We need to make sure we're churning out the next things. But it leaves us a big gap in
Yeah.
we need to be focusing on, well, how do they work? This whole, well, I have to go into this other system to do this work, and then I have to go into this system to do that work.
Yeah.
We talk about onboarding a new employee.
Oh, yeah.
I was a manager. I managed a large team, and I had turnover, and I had new people coming in, and people transferring. Anytime that happened, I probably had to go into six or seven different systems to either deactivate accounts, or order a laptop, or return a laptop, or make sure one was decommissioned, or get access to another system. And I'm like, why am I going to all these different systems? Isn't there one single pane of glass that we could use to put this
Mhm.
together? Because you have, like you said earlier, you have those different teams. You worked in HR, I worked in IT. You have those different domains. We're not even talking about facilities or supply chain or finance yet, right? Payroll, all
Yeah.
these different areas that need to be working together because it's all part of a life cycle, right? So whether it's
Yeah.
onboarding, asset management, anything, it's all part of that life cycle. And each domain owns a piece of that. And that's not working together, you're not having a good experience for the employee.
Well, and to elevate that even further in healthcare, I mean, clinical provider onboarding and nurse on, I mean, you add the whole credentialing component and provider enrollment component, and the fact that these providers could be working at multiple different locations under the same health system and
Exactly.
umbrella. Like in my experience, it has been just inherently a struggle to get this to work well. And it's almost like, I hate to be the Debbie Downer, right? Because, and don't worry, guys, we'll get to the solutions in a minute, but let me vent for a little bit. I mean, I I have to say I'm guilty, right, of being the person in HR who has the responsibility of designing a process. And all I'm thinking about is, what do I need from the user to get this process done? Right? What do I need to hand off to the next team that takes the baton from there? And it is so easy to get stuck in that trap where it's like, well, this is what I need for the process to work. So we're just going to have to do OCM and make sure that the users are trained. And this is just what they have to do. But I'm telling you, if the process is awful and the experience is awful, it doesn't matter how much you can OCM all day long,
Yeah.
but a frustrated user is not going to embrace your process. And
Right.
I don't want to create frustrated employee experiences,
Right.
right?
Yeah.
So I'm just being a little vulnerable because, I've grown in my career since then, but I do remember having that perspective on things. And I hate to say it, but those processes were not great experiences for our people. So if anyone out there can relate to me, then I think we're in the right place and we're talking about the right things. So Brian, what what advice would you give to an organization or to a platform owner more specifically who has a role in designing process, working with those business process owners? What advice would you give to them to improve the user experience?
Well, first and foremost, you need to understand who your customers are. You have different sets of customers as a platform owner, especially a ServiceNow. You have your internal customers. You have the folks who utilize the system. Your idle fulfillers, your demand users, your HR practitioners. They're all using the system as fulfillers of a request, or trying to assist and help prioritize projects, or trying to assist and do break fix of work to make sure everything's happening in the system. So those are your process owners. Those are your internal stakeholders, and then you have your, so quotes, external stakeholders, that
Hmm.
are the people who are requesting services through the system or through your process. We're not, like I
Hmm.
said, we're not just talking about ServiceNow. There are other systems that do work in the
Hmm.
back end here, that ServiceNow works well with. So no matter where they're doing that requesting or requisitioning of whatever they're utilizing, that's where you need to focus on working with your process owners, so the process owners can then work with those external customers, and you can all work together to build something that works for everybody. Now, is that a nirvana? Absolutely. It's never going to work perfectly for everybody, but I feel like we can move that needle so far just by making sure that we are inclusive in our process design, and we're
Yeah.
inclusive with our technology builds.
You know what? That's perfect. And it reminded me of a technique that I've used in the past and that, we use to help our customers build good processes, which is design thinking, right?
Yep.
It's this concept of really starting with the end user and starting from a persona-based experience. And so it's those times where we can, it's not just let's get requirements and let's build it. It's, hey, let's get your different personas, to your point, your stakeholders in a room, and let's talk about what would create a good experience and also get the work done,
Yes.
right? So yeah, I think that's absolutely, and you and I both have kind of been through that process and seen the value
Yeah.
of designing user-based experiences. So what else? Anything else you'd add to that?
I think you want to create a unified user experience. You want everyone to have that same experience, whether you're interacting with IT or HR, or supply chain, or your ERP teams. But kind of automate what can be automated.
Yeah.
That's a big leap, for a lot of places. I mean, and it was a big leap for me when I was working there. I mean, we were able to automate some things, but it was hard. It was hard to do because you had to get a lot of people on the same page. You had to get a lot of core data together, and I think what helped us is we just took small chunks of it, and we said,
Hmm.
okay, well, it's a 10-step process. Let's automate 4 steps of it,
Hmm.
and then let that sell. That way, the different organizations, inside of your healthcare setting, they can maybe dedicate some time or resources to assisting in future projects. So, bite off what you can chew. Terrible anecdote, but just starting small, crawl, walk, run, fly, rocket,
Yeah.
zoom, right? So,
Yeah.
definitely speak a lot about your successes, because that's only going to help your peers grow within your organization, within your industry. We all need to be doing better for the patients. We need to be
Yeah.
making sure that the providers are focused on their patients and they're not focused on navigating broken processes.
Yeah. Oh, you're so right. And speaking of your successes, right? Like that's OCM at its finest, right? And for those who may not know the term OCM, I'm referring to organizational change management. Like, how do you drive adoption? So building a good user experience and showing how that's helping the organization, helping the patient. I love it. So here's something though, which I think is a good transition into the second major challenge that we're going to talk about. Um, when you automate something, you have to have a good foundation for it to be automated. So help us, Brian. What would you say is like that second big challenge?
Data.
Mm,
Jacked up data, I think is what causes us the biggest headaches. Because when you're working with an organization, even if it's a small community hospital or it's a 1,200 bed city hospital, right? You are still dealing with the same attributes, the same value of information that's coming in. And I'm not talking about patient data yet. I'm just talking about people data,
yeah.
location data, financial data. Because if you're requisitioning something, you need to know who's requisitioning it, who's approving it, where it's going, and who's paying for it. So cost centers, locations, job roles, job functions, job titles, signing authority for
Hmm.
people that need to be approving these requests. And it's just probably millions and millions of data points that may not always line up in all the different systems that we're using. We mentioned, we need to go to 6 or 7 different systems to accomplish a task sometimes.
Hmm.
And those different systems may have different nomenclatures or different naming conventions for what a building is or what a floor is. I know all the time we would refer to the floor of a hospital as, say 5 East. But that was what the nursing staff call it. That's not what facilities called it. That's not what
Mm,
payroll called it.
yep.
So you're looking at all this disparate data. And if that doesn't line up, these systems, so you're talking about design thinking, now we're talking about systems thinking. These systems are not going to work together because they're not talking to each other in the same
Yeah.
language.
Oh my gosh. Yeah. I'm having like some PTSD for a minute here because my background, as you know, is HCM implementations. And let me tell you,
Oh
this
yeah.
is a problem. It is really hard, especially in healthcare, because it's the data models are so complex, right? I
Oh yeah.
mean, let's talk about jobs for a minute, like job titles. You could have um a physician, but the physician could be an anesthesiologist, or they could be in the emergency room, or they can be a hospitalist.
Yep.
There's just so many different flavors of roles, and it's constantly changing and evolving, and each flavor has different requirements that, guess what, drive a process. So I mean, the other thing I'll add too, Brian, just from my experience, is that what happens when the data is not accurate is the people that have a job to do, they build a manual process
Oh
to
yeah.
overcompensate for the data integrity issues. And then suddenly you have all these extra spreadsheets, or you have all this extra code in your system that's trying to solve, basically be a band-aid instead of addressing the root cause. I mean, tell me I'm not alone here. Is this
You're not alone at all. I think the over customization of systems has definitely caused a lot of re-implementations of systems, and it's a lot of money. I mean, these systems are a significant investment for any
Yeah.
organization, especially healthcare. When we're putting these things in place, if we're not getting it right the first time, they're not only paying the subscription fees for the system, they're also paying to re-implement it. They're paying their teams to focus their time and energy redoing work,
Yeah.
rework,
Right.
rather than allowing them to build and enhance other things. So making sure that we do a lot of data normalization in the beginning, or when
Hmm.
we're reworking, it's okay. It's okay to do rework. We just want to avoid it where we can. Really back to process design. I'm probably going to say that 100 more times today. It's going to be in my epitaph about make sure you have core process design, or you will not succeed. And sometimes you just got to go back to basics.
Yeah.
Like just a lot of this data structure, it's foundational. You cannot be, putting a roof on a house that does not have a good foundation. That roof will cave in. that house will cave in. So if you're focusing your time, trying to make things look pretty, or to do things that are attractive, or do things that are cool that you saw at a conference, and you don't have good foundational data, you're not going to get anywhere with it. It's just not
Mm.
going to work for you.
Yeah, I think that's really good advice. And, kind of want to dig in on the customization piece, right? I mean, we see a lot of that with our customers, right? Because they kind of realize that this has gotten out of hand. Do we need to re-implement, or how do we fix this? Brian, what would you say to a platform owner who's like, yeah, we got some customizations, because not all customizations are bad, right? Like, we don't like to look at customization as a bad word. But I mean, how do you help IT leaders and, discern, like, when are they getting into the red with customizations?
Well, so these are purpose-built tools, right? So you talk about HCM tools, you talk about SCM, so supply chain management, human
Hmm.
capital management tools, your ERP suites, ServiceNow for ITSM and other project management, HR. These are purpose-built tools. So
Hmm.
I think it's would behoove all of us to make sure that we're following the processes that are designed in the system and adding our flavor to it, but
Hmm.
not completely changing the recipe.
Hmm.
So if you want to, do something on the side, you want to do something that's going to be purpose built for yourself, and you've been thoughtful about it, and you've included your customers, and it works for you. As long as it's not causing headaches for your other customers, I think that's where the line is. Because
Mm.
if we're designing a process, say for HR, and it's not working for IT, then we're kind of causing conflict in the process and the system design. So that's where that line would be. But yeah, no, customization is great. I mean, that's probably how we came up with such great systems and such design, is that the industry experts and the industry leaders worked with some of these SaaS products and these platform as a service products, and had them create new things from new thinking, but really focus on being core, being
Hmm.
brilliant at the basics.
I love that. And I think that's where, having a good implementation partner who's really experienced in the platform, experienced with your industry and your business process, kind of validating, like, is this a use case for a customization, or is there a feature that comes out of the box or maybe is on the roadmap for the product that we can leverage so that we can streamline upgradability and things like that. So absolutely, we kind of live and breathe that life day in and day out. Um, and it's funny, Brian, because when you were talking again, you went back to process.
I do that a lot.
Yeah, I know. Anyways, it's a good lesson. It's a good lesson. All right, let's hit our third topic here, and then we'll collect some questions from the audience. So what would you say is the third major challenge?
So it's your stakeholder prioritization. So I think
Yeah.
we've been leading up to this, right? Because we talked about
Hmm.
data governance structure. We talked about for your frustrated users. Well, how do we kind of bring that together? What tools and processes that can we build out to make sure that all voices are heard? If you work in healthcare IT, you work in healthcare, you know who the loudest voices are. I don't have to tell you. And sometimes they're great voices because they're your customers, and sometimes they're draining out, 10 or 20 other voices that need to be heard equally as well.
Mm.
So these clinical leaders, these business leaders, they all need to come together. They need to work on a governance strategy for prioritization. ServiceNow was an IT ticketing system when I first started working with it. It is an enterprise platform now. It will not
Yeah.
work with just IT all by itself. Or it will. I mean, it'll obviously work for just IT, but if we're expanding out into these other areas and talking about system design and having these systems talk to each other, have these processes work end to end in a life cycle,
Hmm.
we need to be thinking about that cross domain strategy. How are we working together with our partners that may be in other silos? So that's really important. And bringing them to the table to prioritize what work needs to get done, doing
Yeah.
your roadmap, making sure that what's being worked on operationally, and you're steering your team's operational bandwidth
Hmm.
appropriately, and then general management of like your maintenance and management of equipment, like IT assets, facility assets, clinical device management, all these
Yeah.
different areas that if we're not all working together and kind of prioritizing what work gets done, you're not going to see the best value. Like I said, these are significant investments. Um, for teams and with time and money, we want to make sure that we're putting that time and money where it's going to make the best effort.
Yeah, and you hit on something, Brian, that really piqued my ears, which is, you know, ServiceNow as an example of an enterprise platform. I mean, this stuff's not cheap. Like it's a big investment. And if you're only using, I heard a CIO yesterday referred to the platform as an 800-pound gorilla. But if you're only using 100 pounds,
Uh,
then you're really getting value from that. So I think that's really important for our audience to hear. And I would guess that there's probably a spectrum. There's probably folks out there who are only using it for, IT or components of IT. And then there's others that have like really, a lot of our customers, right? They've
yeah,
really embraced the enterprise service management vision, like the single central location, the one start shop, to deliver services across your entire enterprise to the same users. And that vision, it's more expensive, but that's when you actually start to realize the value because you're streamlining your operations, you're automating stuff, your users are getting work done better, and faster. So yeah, I think this is such a great point for our audience to just ponder and really think about, like, do I have an enterprise strategy or do I have an IT strategy?
yep, exactly. I think like leading into where you were at there with the IT strategy and the HR strategy and having that together, I want to just call out a point you made. And just I think you said the word investment, the amount of times I said the word process. It is absolutely an investment, but you do it right, you get a return on that investment,
Yeah.
and you can get huge returns on that investment, and that could pay you back in ways
Yeah.
that you don't know because you're making things easier to do. You're reducing that almost $400 $400 billion spend an overhead.
Yeah.
So I think that just making sure that you have focus on your ROI, making sure what you're doing is being measured. So if you're
Mhm.
implementing a new process, are we looking at are we improving that process? Yes or no? And if over time, are we going to be continually improving that process, or are we going to try and do something differently? And then, or maybe do we need to fix some of the technology? So, um, just I wanted to call out that investment piece. It was very
Yeah.
meaningful.
So Brian, one last question for you. What advice would you give to an IT leader who maybe they have the enterprise vision, but their peers in the business are, really locked in on their own systems or really locked in on their own kind of agendas and not really open to hearing about it. How could you help that leader get those people on board?
So, a lot of times as a platform owner, and you're working with your peers, you're working with your leaders inside of IT or inside of a strategy organization, you become the proverbial prophet in your own village, right? Sometimes you just need a little backup sometimes. So definitely find yourself a trusted partner. A trusted partner who knows healthcare. We can definitely look at the advantage of using health or excuse me, ServiceNow outside of just the IT space. So that's number one. There's
Mhm.
always an opportunity to do an assessment. Like, how am I doing? Am I getting a good report card? So do that internally. Am I getting
Mhm.
a good report card for my customers? Am I doing good surveys? And not talking about those surveys that go out after the incident's closed. They have their own value in a different space. I'm talking about, is my tool providing value to this organization? So those
Mhm.
pulse surveys, quarterly, biannually, and then work with that partner to build out a strategy. Like, are we going to be, you made that investment, and we all know it's a couple year contract at the least. So what are we doing over that couple years to make sure that we're getting return on our investment? So those are the top three things. So cross domain strategies, working with your peers,
Yeah.
working with leaders, get a good partner who knows healthcare, and then work on a partner to evolve, work with a partner to evolve that strategy over time. Like this is a living, breathing thing where we're constantly improving.
Yeah, I think that's great advice. It's again, it's what we kind of live and breathe every day, but um sometimes you just need another perspective, and you kind of need to roll up your sleeves and get into the numbers, right? Numbers don't lie. If you can tell your business peer that, hey, I know that you really love what you're doing right now, but this is what you could actually save, or this is what you could accomplish. That business case is really important. So great
Absolutely.
advice, Brian. Thank you so much. Scott, do we have any questions from our audience?
We do, and if folks have additional questions, please continue to drop them in the Q&A. And yeah, that was great. You can really tell that you guys have been on the ground. You've worked with all layers of the organization, and you really understand this is an enterprise solution. One thing with the jacked up data, first of all, is that a technical term, Brian, or?
No, that was a term that came out of a meeting that we had a couple weeks ago, and I think we just got it tattooed.
Yeah, sure. And I'm sure everyone can relate. But having so much jacked up data, it can feel super overwhelming.
Mhm.
Where when you do feel like it's just beyond jacked, how do you where do you start? Do you have any suggestions where someone can start to kind of overcome that feeling of
So I think it's really important for us to understand the term data ownership. So who owns your data? I mean, not every organization is going to have a data and analytics team, but someone in HR should probably be responsible for the HCM information. Someone in finance should be responsible for the payroll information, and they're accountable for that, pun intended. So having that data owner in there and having those data owners work together over time, it's going to take time. It's
Mhm.
not going to be an easy feat. Data normalization is probably one of the hardest things that I have ever done as an architect, as a technology leader in every space. Data, so having those data ownership aspects makes life so much easier.
I would even add to that, Scott. Sometimes it even requires an organization needing to go back and look at all of the terminology that they use to describe their data, right? Like it's like what Brian and I were talking about before with like, locations or some of that master data that's like really core to an organization's structure. It's driving your chart of accounts, it's driving your HR process. Like sometimes you need to go back and you need to really look at how, like, map that field across your entire process. Do it experimentally, and see like, oh, in HR it's called location, but in the facility system it's called a facility, but it's the same field. Or, oh, this field gets modified along the way because there's some customization in this integration. You know what I mean? Like you got to like really get into the weeds and just start somewhere. Take some of that core data, and it'll start to overturn rocks for you. And then work with an enterprise architect, work with a data architect, someone who understands enterprise process, and start to put together the remediations that are needed to get your data back on track.
That's awesome. Thank you both. Coming back to the question of ROI and
Mhm.
this idea that the data behind the savings, or the data behind, and the importance of layering that into the system early. Do you think that that's something that can be done in the absence of knowing the enterprise strategy, or does it have to be done in collaboration or in coordination with whatever the strategic objectives of the organization are?
Hmm. I can take that one first, and Brian, I'd love for you to add on. So I would say start with your sphere of influence. Start with your territory, right? If there's an executive leader who's like, yes, let's do an enterprise-wide business case ROI analysis, like let's really tell this story from the enterprise level. Amazing. That's like a dream come true. But that's not always reality, right? Like sometimes, and again, I'm biased to HR for obvious reasons. So maybe your HR leader really, really wants to look at that, but maybe the other leaders are, they kind of already have their marching orders. Then you can absolutely start. You just have to start somewhere, right? And I'll give you a real practical example that I've literally done in the past. Let's say you're talking about, I helped a customer one time with helping them determine what kind of what they would need to staff their HR shared services organization in order to support the user requests, because they were implementing ServiceNow, right? They were implementing HR shared services. Like, okay, well, what are your HR shared services or your HR generalists doing today? Let's pick a few key processes. Let's map it out. How much time is it taking them to complete a process? Let's say a leave of absence request, right? How much time does that take? And then, okay, how much time can we save from that by streamlining that process and using technology? And then how many requests do you get per month, per year? Like, you can start really small and tactical and ask some simple questions and start to extrapolate a big picture of cost savings, of more scalability with how you staff your operations, better user experiences. So that's my advice in a nutshell: is start small, 100% okay. When you start to tell that story, other people are going to be like, oh, maybe I should do something like that. And then suddenly you have an ROI story forming that is very compelling.
Yeah, I totally agree with Natalie. I mean, Natalie, you nailed it. It's starting small, and then selling your story, and
Mhm.
making sure that folks can see, what's in it for them, and making sure that we're all going to be working together as part of the growth.
That's awesome. Always start small. That's just advice for life, right?
Life.
uh, Question here about the systems. What are some signs to identify if your current system isn't following an end-to-end process design?
You want to take that, Brian?
Sure. That's a fantastic question.
Mm-hmm.
It definitely needs some. It definitely needs some analysis. I think looking at your process and mapping out your process to start with. I mean, Natalie just talked about this. You take one of your processes that you have that you don't know whether it's efficient or not. You just want to take a look at it and see what time it's taking to complete a task. I think there's some obvious things there, right? If you're working in one process, if you have to jump into multiple different tools, or if you as a leader or you as a user or a fulfiller need to go into different tools to complete that one task and do manual steps, you're absolutely not having good process end-to-end process design. But mapping it out and then looking at it constantly, looking at the numbers that are coming out of it.
Mm-hmm.
We talked about how we can just make small incremental changes to get better return on our investment, save time, save steps. But there's also the anecdotal things that come out. I watched Jeff Bezos on a podcast the other day, and quoting him, he said, you got to listen to your anecdotes as well. So if your
Mm-hmm.
employees are saying it's taking me too long to do my time card, well, and the leader's like, well, it's just your time card. You have to do it, right? You're not listening to that anecdote, or or you go to your data and you say, hey, it takes you 39 seconds to do your time card. Well, maybe my time card should only take me 10 seconds to do. So making sure you're listening to your data, but also tweaking it over time to improve it, and listening to those anecdotes that are coming out.
Yeah. Would you say, Brian, too, that like you almost have to be put your inspector gadget hat on? Like,
Yeah.
you kind of got to be an investigator and ask a lot of questions. Talk to people you don't normally talk to,
Yeah.
and ask some questions. And get those people in a room
Oh, yeah.
sharing what their day-to-day looks like, and you start to connect some dots. There's a methodology I've used in the past called SIPOC, which is basically a process mapping methodology where you really look at like what are all your suppliers of information, or and then what are the process steps, and then what are those outputs, and you just kind of map it across, and you start to really learn more and expand your panoramic vision of what's really going on.
Yeah.
That's awesome. Thank you, guys. I have dropped some links in the chat. If anyone wants to connect with Brian, with Natalie, I shared their LinkedIn's in the chat. There's also a link to Optimum Healthcare IT ServiceNow landing page. Go there, check out everything that is happening with Optimum Healthcare IT, specifically their ServiceNow practice. And then lastly, there is a link to the Healthiest Tech Spotify. So you can go and you can subscribe and you can listen to this. Like Natalie finds people at the gym. Maybe you'll find someone, Natalie, next time at the gym listening to the next Healthiest Tech. You never know.
That would be so cool.
They won't be complaining anymore. They'll say, here it is. It's the solution. So listen, thank you everybody so much for joining. Brian, Natalie, thank you for taking time after your afternoon to come and talk to us about this. Looking forward to the next one. The next one will be next month, and we're going to be looking at how a large hospital system, Tampa General, how they were able to really transform their HR operations in just 8 weeks. So be sure that you join us for that.
Thank you, Scott.
Yeah, any closing remarks?
No, just thanks for having me, Natalie and Scott. Thanks for moderating, and you know, teams, definitely reach out if you want to chat. You want to talk more about things, and I just really appreciated the opportunity to share my experience and chat with Natalie as always.
Yeah, and likewise. We love talking about this stuff. So even if it's just you know, having a conversation, it's great to get different perspectives. So I hope to meet you guys, and I'll be on next month talking with Tampa General. So hope you can make it.
Awesome. Thank you guys. Have a great afternoon.
Bye, everybody.